Okay, great. Hi, everybody. Thank you for coming out on this beautiful Seattle evening and spending your time with us. My name is Jessie Jones-Smith, and I am an obesity epidemiologist. And I'm most interested in the role of economic resources on obesity risk. And one of the ways that I study the role of economic resources on obesity risk is by looking for natural experiments that change the economic resources of populations, or what I call natural experiments that induce economic shocks. I'm attempting to put my pointer on this. So these economic shocks can be either positive or negative economic shocks, where a positive economic shock might be something like a poverty alleviation program or a new tax credit, say the earned income tax credit, either a boost to that or a change to that. A negative economic shock might be something like a recession or factories closing in communities. So what I'm interested in is finding these situations and then finding ways to evaluate the impact of these economic shocks on weight-related health, in particular obesity. So I'm going to tell you a little bit about my research in that realm, but I wanted to start with just one slide of background. So in the US, obesity is a pervasive public health issue. So we are all affected by obesity. We're all susceptible to weight gain in the current environment that we live. At the same time, populations with lower incomes experience a disproportionate risk for obesity. This is particularly true for women and children. And there are lots of proposed mechanisms by which having low economic resources might lead to an increased risk for weight gain and eventual obesity. And so what I'm showing you here is 6 hypothesized pathways by which having low income or low economic resources may result in an increased propensity for weight gain and obesity. Now, many studies look at these pathways kind of individually. What my research does is focus back here on the economic resources themselves, because it's my opinion that if we can find ways to shift, to move the needle on those economic resources, that then we might be able to address multiple of these pathways at the same time, thereby having a bigger impact on childhood obesity, and maybe not only childhood obesity, but other health outcomes as well. So that's the motivation for me and my interest in identifying these economic shocks and seeing what happens to health when populations experience an increase in economic resources or, on the flip side, a decrease in economic resources. So I'm going to tell you about 2 such studies that I've done over the last few years. One looking at a positive economic shock, and in this case, the positive economic shock is coming in the form of a Native American-owned casino, and I'll tell you a little bit more about that on the next slide. In the second case, we'll be looking at a negative economic shock. In this case, this will be more familiar to most of us in the room. We're looking at the Great Recession as a negative economic shock. In both cases, I'm interested in evaluating the impact of these shocks on childhood obesity. So let me get right into this first study where I'm modeling Native American-owned casinos as potential positive economic shocks for Native American communities. Let me tell you a little bit about why I and other researchers have thought of these casinos as a potentially positive economic shock for Native American communities. First, it's important to understand that in the eyes of the federal government, when the federal government recognized tribes' right to operate casinos on tribal lands, in the eyes of the federal government, this was due explicitly to the ability for casinos to potentially produce means of economic development and poverty alleviation for Native Americans. Because of that, in this act, it was mandated that all the profits from casinos to tribes had to be reinvested in the welfare of the tribe or donated to a charitable organization. And tribes have complied with this in a number of ways, 2 of which I've listed here. So many tribes decided to issue per capita payments from the casino to their tribal members. You can think of these per capita payments sort of like dividend checks from the casino. So the amount of the payment depends on how profitable the casino is, and it's split equally over the tribal members. So in this way, casinos can directly impact the income of Native Americans who are affiliated with the casino. An additional way that tribes have complied with this mandate is by reinvesting in their community infrastructure or building up their community infrastructure. So in ways that are related to potentially obesity, the outcome that I'm interested in, tribal leaders have reported investing in things like recreation centers, parks and playing fields, sidewalks, and for tribes that have really profitable casinos, even larger investments like safe, stable, and desirable housing for their tribal members. So researchers like myself who are interested in the fundamental role of economic resources have tried to link up data about casinos to data about Native American health to see whether this potentially positive income shock has any negative or positive impacts on health. So my study, I was able to do this in California through the use of pre-existing data. So in California, there are 100 plus Native American tribes. 60% of these tribes own a casino today. I was able to find pre-existing data from the California school system, which it turns out has been measuring height and weight on all kids in 5th, 7th, and 9th grade since the year 2001. And so we were able to use 12 years of this data, which resulted in a sample of roughly 23,000 Native American children. Our study design then was to think about children who were living in communities that over this 12-year period opened up a casino, and thereby we hypothesized they'd see increased economic resources coming into their community. And at the same time, we had a set of children who were living in communities who were eligible to open a casino but did not do so. And so those children kind of stood in for our comparison group. Our goal was to look at how obesity rates changed for these places that opened up a casino compared to those places that were eligible to do so but did not do so. We found that, in fact, these casinos were associated with significant improvements in incomes for Native Americans living on tribal lands in these places that opened casinos, above and beyond secular trends for those Native Americans living in places that didn't open casinos, and decreases in poverty. We also found that this was associated with our improvement in our health outcomes. So childhood obesity, that was the first health outcome we looked at with that school data. Then we layered onto this and looked at birth records and found that these casinos were also associated with the decreased probability of being born at a high birth weight. So here we're seeing this positive economic shock result in a health benefit in terms of decreased childhood obesity. Quickly getting into the next study, this on the flip side is a negative economic shock, and I should say that this work was led by a doctoral student of mine, and we were really interested in whether the Great Recession had detrimental impacts on children's BMI. And again, we were able to study this using that same set of data from California. In this case, we didn't limit our sample to Native American children, and instead we used children from all race ethnicities, and this gave us hundreds of thousands of observations from kids who we were able to observe their measured height and weight before the recession and then after the recession. So we were able to look at how the same kid over time compare their BMI as the economic conditions around them changed. And we tested whether worsening economic conditions, as indicated by county level unemployment, were associated with BMI. What did we find? Journalists have a way of getting right to the point here. Did the Great Recession result in weight gain for children? Yes. We find, in fact, that counties that experience more severe economic recession, kids in those counties experienced greater weight gain as compared to counties that experienced less severe forms of the Great Recession. So in the end, I've told you two very short stories about two economic shocks, one positive and one negative. However, what we see are consistent conclusions in terms of the impact of these on weight. So we see that in this positive economic shock that obesity goes down, and in this negative economic shock, we see this results in an increased propensity for weight gain among children. So I think that this tells a pretty consistent and compelling story about the fundamental role of economic resources in childhood obesity. And I also think that that we have the potential for improving obesity risk if we are able to think of solutions that actually can act on and move the economic resources for low-income populations. So thank you.